Thank you. I really appreciate the opportunity to be here and to provide some of the data that we have on infant partner violence and some of the work that we're doing in violence across the lifespan. The Injury Center itself is focused on preventing injury and violence so that people can really live to their fullest potential. And our vision is to put injury and violence prevention on the map as the premier public health achievement of this decade. We know that injuries are a leading cause of death for people basically from the ages of 1 through 44, and certainly responsible for many deaths in the other age groups. And we take a public health approach to preventing injuries and violence, going from surveillance through research and program evaluation, identifying what works, disseminating the effective interventions, and then translating them and scaling them up so that we can affect a broader population. And then evaluating their implementation, looking for unintended consequences, and continuing the surveillance. In the area of violence prevention, there's several focus areas that we look at. Child maltreatment is certainly a major area for us, as is youth violence, intimate partner violence, sexual violence, suicide, and elder maltreatment. One of the, we have a lot of data and a lot of information on intimate partner violence, youth violence, sexual violence, and child maltreatment. We're lacking a lot of research in the area of elder maltreatment and how it relates basically to the other forms of violence. So we are starting to do more work in that area now, and we hope that there will be other work supported there so that we can gain a better picture of how this relates to the other violence that occurs across the lifespan. Violence against children and youth, we know that each year there's almost 500,000 cases of child abuse and neglect. 1,770 children died in 2009, and we know that the costs associated with it are tremendous. The total lifetime cost for 1 year for children who are abused is $124 billion. This is a publication that we put out this past year. Homicide is the second leading killer of youth between the ages of 10 and 24, and actually the leading killer of young black males, adolescent black males. And 12% of high school students report being in a physical fight every year, 20% report being bullied, and about 10% report being physically hurt by a boyfriend or girlfriend. So intimate partner violence is starting at an early age, and we know that it continues then as people get older and get into other relationships. We're also seeing more and more evidence of the impact of violence on early brain development, and it certainly affects then the lifespan. And now there's evidence that DNA is actually changed by exposures to violence and by violence that is occurring towards in children and youth. It does impair cell growth, it interferes with the formation of the healthy neural circuits, and then it damages the stress response system. So we have a lot of work being done in that area. We also know there's other consequences of childhood exposure to violence, and I think a lot of this comes out of the Adverse Childhood Experiences study. But health risk behaviors are a major issue. Things like sexual promiscuity, perpetration, alcohol and drug abuse, smoking, diseases and injuries, STDs, including HIV, other problems that are chronic illnesses, and then mental health and well-being issues. Also, have a lot of evidence now about the various types of violence that occur, and I think we're really focusing on how do we interrupt some of these cycles. For example, the exposure to parental intimate partner violence sets a sort of pattern for children and for teens, and then we get into issues of teen dating violence, and then gradually intimate partner violence as they grow into their adult years. We want to stop this cycle, we want to prevent it, we want to stop these exposures. Sexual violence and intimate partner violence certainly are major issues, and based on the National Intimate Partner and Sexual Violence Survey results that we released in December of this past year, there were 12 million victims of rape, physical violence, or stalking by an intimate partner in a year. So annually, that's what we estimate is going on. Most victims first experience this before the age of 25, and for men, it happens very young. It's generally before the age of 10, particularly for sexual violence. 28% of men who report having been exposed to sexual violence report having it happen before before the age of 10. It certainly has a lifetime impact and an impact on what happens with their relationships. We knew that 1 in 4 women experience some form of severe physical violence by an intimate partner in their lifetime, and 1 in 7 men also experience severe physical violence by an intimate partner. 1 in 5 women reported having been raped in their lifetime, and most of them knew their perpetrators. So these are not, these may be surprising statistics to some people, but again, it's something that we know we can work to prevent. And over $8 billion in costs for intimate partner violence occur every year. There's certainly health consequences associated with all of this. There's a high prevalence in women of asthma, diabetes, and irritable bowel syndrome. And for both women and men, we see more chronic pain, activity limitations, and poor physical and mental health when they've been exposed to some form of violence. We also know there are more about these relationships between the various types of violence. Research from the National Survey of Children's Exposures to Violence found links to several types of violence and teen dating violence, and specifically, every victim of physical teen dating violence reported at least one other type of victimization. The lifetime rate of teen dating violence was 6.4% for all youth, but the rates reached 17% for youth who had been physically abused by a caregiver, 25% for youth who had been raped, and 50% for youth who had experienced statutory rape or sexual misconduct by a partner more than 5 years older. And victims of teen dating violence were also 3 times more likely to report physical abuse by a caregiver, almost 5 times more likely to report a gang or group assault, and 4 times more likely to report unwanted internet harassment. In this chart that shows some of the relationships between types of violence, basically we know we have youth violence at the center here only because we have the most evidence in that area. The ACE study, the Adverse Childhood Experiences Study, the data that we have there relates violence to other forms of violence later on, child maltreatment, certainly to some of the health problems, but we don't have as much evidence from the ACE yet about what's going on longer term. And we are working on that. We've moved that study into our center. It had been in the Chronic Disease Center, and we're in the process of moving it and taking it on and trying to use it in different ways and hopefully at some point expand the population that it covers. Because if right now the population that it covers is Kaiser Permanente, basically health system population. So we're not getting a really good picture across all populations, and we need to get some better data across other populations. Influencing factors for violence, we knew that there are many, but we also know that risks for violence are increased with alcohol and drug use and abuse, people who have mental health problems that are not treated, if there's a history of violence exposure, low income, anger that people don't know how to deal with, anxiety. And protective factors seem to be religious affiliation, social support, and school bonding. We know that there's multiple factors here and that they play a role in increasing or reducing the risk for violence, victimization, and perpetration. And the factors include other risky externalizing behaviors, such as alcohol and drug use, as well as the internalizing behaviors like anxiety and depression. So what do we do to prevent violence? Some of the work that we do, we really try to take the science and translate it into action. So when we have a survey like the National Intimate Partner Sexual Violence Survey, we try to use that data to figure out how we can intervene and where we can intervene and where can we take some steps that will make a difference. For child maltreatment, for example, one of the programs that has been found to be very effective is the P program or the Positive Parenting program. One of the challenges with that program is very labor intensive because it involves, it's a socio-ecological model, it involves getting a lot of services engaged with high-risk groups and parents who are at risk for not adequately parenting a child. So we have a challenge of scaling that model up. Youth violence, academic centers for excellence in youth violence prevention. We fund 4 of them around the country now. We have funded others in the past, and they are doing work looking at what works in the community to prevent youth violence. Bullying is another issue that we're working on. There's a national effort on bullying, and we're doing an evaluation of a project called Second Step. Intimate partner violence, certainly family-based prevention is one area that we're working in. And in sexual violence, the Green Dot evaluation, which is a community-based program that looks at bystanders that would to try and find out, identify early on when something is going to happen or something is happening. We are also looking at public-private partnerships and how can we enhance those and really use them to prevent violence in the community. We have a partnership in NPEIV with the Doris Duke Foundation, the Dating Matters project that we have, now funded in 4 cities. We partner also with the Liz Claiborne Foundation. So there's places that people have an interest in doing something and it can make a difference. The other area is really building capacity and implementing programs. Domestic violence prevention enhancement and leadership through Alliance's program, the Delta program, exists in 14 states, and actually right now there are a number of states from the Delta PrEP program, which are states that are getting ready to implement the Delta program, are meeting in Atlanta to discuss some of their successes and some of the things that they can do in their states. We fund states and territories and DC in the rape prevention and education program. This is really focused on both intervention and prevention, and we're working, there will be more work being done on evaluation of some of the best practices there. We have the Striving for D2 Violence Everywhere program. We've now funded 4 communities. This is a multi-sectoral approach to preventing youth violence, and it takes the whole community to engage and really work to prevent youth violence. Dating Matters, as I mentioned, is in 4 cities right now, and we're testing that out in urban populations. And then we have the Urban Networks Increasing Thriving Youth, the Unity City Network, which is really working on, again, a multi-sectoral approach within some major cities to prevent youth violence. They're all a challenge. It's much easier sometimes to talk to people about how do you prevent unintentional injury because you can talk to somebody about putting a seatbelt on. It's a little bit harder to say how do you get a bunch of partners together and figure out how to prevent violence. So it's more of a challenge, and I think we all have that challenge. So one of the things we do know, though, is that both prevention and partnerships are really key to ending violence and ending violence in the community and in the home. And so we are working in these areas, and if you need more information or would like to know more about what we're doing, please go to our website, and you can also contact Christy Schwartz, who is in our DC office, if you need any information here, she can help you out. And Christy is here too if you want. So thank you.